Hello, my name is Dr. Russell Schafer from NOLA Dentures and General Dentistry. Today I'd like to talk about TMJ. When people come to me saying they have TMJ, what I generally assume their meaning is they have pain in their face or their jaw muscles that isn't related to their teeth. Now the TMJ itself actually stands for temporomandibular joint, or the joint right in front of your ears right here. What I typically call this is either called TMD, or temporomandibular joint dysfunction, or I call it oral facial pain, just a generalized term for anything in the face or the mouth or the jaw that doesn't involve teeth pain. Now, I find that oral facial pain, TMD, TMJ, it kind of usually comes in two different types, and it depends on when it hurts. Now, sometimes people complain about pain in the morning, whereas other people complain about pain during the evening. For our patients that complain about pain during the morning, this is often due to clenching or grinding at nighttime, and it can even be due to snoring. What I find is that at nighttime, we're just able to beat the heck out of our teeth. In fact, nighttime clenchers can actually clench 3 times harder than you can during the day when you're awake and when you're conscious, because your body just doesn't feel it. For these patients, what I typically recommend is that we recommend a night guard for you. What the night guard does is that it doesn't stop you from clenching or grinding, but it actually kind of braces your teeth together so that you're not able to clench or grind on one spot alone. Now the second type, the type that happens at nighttime, the type that happens at the evening time, is generally caused by daytime clenching or grinding. And this is a little bit more tricky one to solve because it's typically habits that we've developed during the daytime that aren't very useful habits. So for example, a lot of my engineers will grind their teeth when they're at the computer, or whenever people are, maybe sometimes my police officers, when they're just driving around town. We have certain actions we just take where it's just a habit just to grind our teeth all day long. And these are the hard ones to break because they're habits. The way I recommend breaking these habits is with something I call personal self-regulation. All this really means is trying to figure out when you're doing the habit and stop doing the habit itself. And the way I actually find works the best to stop clenching and grinding is actually with your cell phone. For these patients that clench and grind during the day, the trick is have your cell phone buzz you every 15 minutes to see if you're clenching and grinding. And if you are clenching and grinding, you gotta stop clenching and grinding then. Patients that do this, they are always amazed about how often they actually are clenching and grinding their teeth during the day. And it might take 3, 4, 5, or 6 weeks for them to actually break that habit. However, you just can't give up. You gotta keep on doing it until the habit's broken, and it will eventually stop. Now, the other problem sometimes that happens, and this is pretty common with my teenagers, is actually chewing gum can actually cause the same level of problem. The reason is that normally humans only chew 15 to 35 to 45 minutes a day. People that chew bubblegum can easily chew 4, 5, 6, 7, 8 hours a day, and they just beat the heck out of their jaw joint, beat the heck out of their muscles. It's kind of like, again, to go back to the marathon analogy, it's kind of the difference between running a marathon or 26 miles and running a 5K or about 2 miles or 3 miles. If you ran marathons every single day, your legs would be sore. If you chew bubblegum every single day, your mouth's going to be sore. For these patients, the solution is pretty simple. You just got to stop chewing bubblegum, which I know for a lot of my high schoolers is kind of hard, but it really does make a world of difference. If you're kind of wondering what makes the most sense for you, give us a phone call at 504-392-5104 and we'll help you out. Thanks.